Hey, I'm Dr. Talklin. I'm a licensed counseling psychologist, and welcome to my YouTube channel, where I'm trying to destigmatize mental health one step and one day at a time. So don't forget to click the subscribe button. I wanted to talk today about trauma, specifically race-based trauma, because we're inundated with images of police brutality, of violence, of harassment, and the overall killings, constant killings of Black men and Black women. And that has to pose the question, how could our mental health or emotional health not be affected? And so I'm going to rewind and talk about what the basis of trauma is, because we talk about it and we throw that term out, but we really don't define it. And trauma is experiencing severe psychological distress by witnessing or experiencing a life-changing or life-threatening event. And it can be broken down into three components: emotional, mental or psychological, and physical. And we'll go one by one. With emotional effects of trauma, things that a person may feel is intense feelings of anger or rage, sadness, a lot of fear, and also difficulty with emotional regulation, which means emotional control. And so wanting to suppress or to numb so we don't feel the pain because it's so intense. With physical effects of trauma, nausea, GI or stomach problems, dizziness, headaches, appetite changes. This is where sleep disturbances also come in, and not just insomnia, but nightmares, flashbacks, or night terrors. And then there's also a psychological or mental component with trauma, and that is where post-traumatic stress disorder is discussed, of a conglomerate of depression and anxiety, and again, turning to numbing behaviors such as substance use to suppress and to numb those feelings, to blunt that pain. And then when we talk about race-based trauma, it's again experiencing severe psychological distress by the constant witnessing of harassment or witnessing violent acts against someone who looks like you or looks like a family member or a friend or your partner, and institutionalized racism and systemic racism. It's so much stress. So Black communities are affected by constant trauma. And I talk to my clients about what race-based trauma is, what it looks like, what are some symptoms that they may experience. And I talk about hypervigilance or increased sensitivity to threat. So images are seeing a police car or a police car riding behind, or seeing another Black person or Black family pulled over by police and wanting to make sure everything is okay. Also, chronic stress from race-based trauma affects the body. So high blood pressure, so low immune system, also substance use, and not just drugs and alcohol, but compulsive eating, shopping, anything to suppress or numb pain. And also there is something that we talk about, it's a narrowing sense of time, and let me explain that. Constantly having difficulty thinking, will I make it to 20? Will I make it to 30? Will I live to see 40? And so all of those things encompass race-based trauma, and the big question is, how do we cope with it? And first of all, acknowledgement and affirmation and being seen and being heard and listened to is essential. This is where connection of allies or connection with family and friends or connection with somebody's church group, connection with people that get it, that people that are supportive and that one feels safe. Self-care is really crucial during this time, because with all of the trauma, race-based trauma we're experiencing, we're also dealing with a pandemic, and self-care is crucial. So, yes, saying no and boundaries, but thinking of things that make you happy. Or if a person is very spiritual, tapping into a spiritual practice, or practicing mindfulness or meditation is a huge one. Or advocacy. That's a big one too. I have students and clients that go out and do advocacy work, or do peaceful protests so they can engage in something with action. A big one too is rest and recognizing that you're not going to work, or you may not work in the same capacity that you did before. And to recognize that, be aware of that, have insight into that, and to take care of that by encouraging rest. And the biggest thing is seeking professional help. Whether it's a counselor, whether it's a pastor, whether it's a person that one trusts, but to really talk about what's going on and talk about the symptoms and talk about what it looks like. And by seeking counseling, it's a wonderful way to tap into that and to get support when everything is so traumatic out here. So I hope that I gave you a little bit of information. Stay safe, and I'll talk to you soon. Have a good day. Bye-bye.